problem with his left shoulder. It turned out to be adhesive capsulitis. Actually had him referred to a medical doctor, Warren Scott, who did a procedure to shear loose the adhesions. And at that time, I mean, the symptoms were, from what I remember, you couldn't really raise your arm above horizontal.
That's about the limit,
right,
maybe just a little bit above horizontal, maybe.
But 90 degrees.
And a lot of pain, and I stopped being able to sleep on my shoulder.
Right.
Yeah, so it's been a complement of all these different
It's been a team. You've been to osteopath, you came to me, chiropractic, you medical doctor, shear this loose, now physical therapy, and then doing massage, acupuncture. That was the first start with this. There's a lot of cross referral that went on to get the job done. And there's lots of different degrees of adhesion formation. And again, one of the reasons, just to state that in the capsule, it's so richly embedded articular structures with highly a large number of nerves, sensory nerves, and highly sensitive nociceptors and various mechanoreceptors, proprioceptors, all those big words, are richly and sensitively in the articular area, and that's why that was so intense to break free. You had to be under anesthesia, and Dr. Scott did that. But the other adhesions we're talking about are just kind of like we call micro adhesions, adherences, even some viscosities, which are slightly different than actual adhesions, and the myofascial regions here. Which is,
it seemed to be going in a negative spiral. So the physical therapy didn't really produce any results. In fact, seemed to be aggravating the inflammation.
Were they trying to get you to do stretching?
Stretching and pulleys and stretching motions, which weren't really increasing my range. But your treatments with the neck adjustment had calmed down that nerve that you just showed, all the way from the back all the way down to, I was really feeling a lot of it in here too.
It's almost like you had an overlap after the fact, meaning there was definitely nerve impingement in your neck that was contributing to a lot of the pain here. It was just there all the time, the soreness and the pain. And we got that to reduce, but still the issue within your shoulder being able to raise it above 90 degrees didn't really change. That never changed.
There was, so sort of undeniably a scar tissue. And of course we discovered that one day when you gave me the adjustment, trying to make sure my shoulder was seated, properly seated, and we ended up tearing through some scar tissue that day. And an open MRI done, so we could have a look at it, and that came back saying no tearing.
No tearing.
That was a lot not as likely as just the strong scarring. So he laid it out and said what his successful method is, and that it would have to be sort of that he would give me some strong painkillers, and that we would go through a manual manipulation where he would move the arm to the extreme that would allow the scar tissue to tear through.
Right. Now let me go back a moment. I actually did a manipulation adjustment to release any fixation of the joint and simultaneously shear loose whatever amount of adhesions I could. It was very painful. It was painful. It was pre-warned. We did get some shearing, but we realized a few days later, you came back, that it improved slightly the range of motion, the mobility, but not enough.
It was a little sore just from the immediate, but it felt better after that.
Right.
And it was slightly improved, but still there was sort of this hard limit.
Right, and there was more. There was simply more adhesiveness in there that needed to be sheared loose on a greater scale than that under anesthesia or pain meds.
Yes, so it was the procedure was done with pain meds, Vicodin and Valium as allowed for the amount of pain. So I've experienced it both with anesthesia, with pain meds and without, which is good.
And you went to Warren Scott, of course. Warren is a well-known, long-time sports medicine medical doctor. That's how I would label him.
Yeah, so he was not too surprised. He said he's done hundreds of these procedures, and
to shear loose capsule adhesions.
So he sort of laid out where I'm at, what I've tried, and the two options ahead were to let him do a manipulation under some pain meds, or to get general anesthesia and have the manipulation done while I was unconscious.
Get rid of some of the inflammation that's in there to make it a little less intrusive to the procedure he's trying to get to, and also to imagine the cortisone might soften the adhesions which have already formed a little bit.
He was big on softening the the lubricant, he says, can get very congealed.
Right. It's like viscosity.
Yeah, very over viscous, like peanut butter was what he described.
Mm-hmm.
And the mixture of the water in there and all of that is intended. It has multiple intention.
Right. Pain reduction, actual inflammation reduction, and the inflammation, which of course is the precursor that turns into the fibrotic scar tissue to actually soften the scar tissue a little bit as well.
To soften the scar
soften
tissue.
A little bit. Is that the adhesions where they bind are actually a lot looser than the actual tissue, softer than the actual tissue. People believe that say, well, scar tissue heals harder than regular tissue, but we're talking about releasing the areas of the adhesions that are binding to the capsules and to the other structures, and that's what he's shearing loose. And he knew that that required less pressure. If you put too much more pressure, it could actually tear structures we don't want to tear.
Instead, what I felt was immediate relief.
Wow.
I could sleep on my side, on this left side.
First time in months. This has been going since last summer. So 6, 7 months.
And my shoulder just wanted to move, like it was like some animal let out of a cage.
Wow.
It just was like ready to move and ready to test.
Right.
But yeah, it has been a period of getting some muscles to stop over tightening. Right. And other muscles to start kicking in.
Because there's sort of protective mode for having been there for over half a year. And you have to, like you said, retrain the neuromuscular reorientation of the muscles. Yeah.
So as I've been coming back to you periodically, or last week, we did the neck adjustment again, which I think the physical therapist would confirm that it did relieve the reactive side, where the muscles are overreacting and then allowing you to stretch.
Yeah, just to state the obvious, a lot of the muscles that attach to the arm, the deltoids, and a lot of others, we don't need to name them now, but they go up into here. Some of the ones that come from the muscle and the neck, they all overlap. And of course the nerves coming out of the neck, like we showed a few moments ago. So I calmed all of that down, that aspect of it. Let me ask, is the physical therapist doing any massage work on you?
They're doing a lot of direct manipulation. It's not just me
pulling
on. Yes, today she worked on the scapula and pushing in and trying to calm areas of the scapula.
So she's doing kind of massage or manual therapy type of movement. Some probably osteopathic, chiropractic massage, moves of different sorts to get where this tissue's become contracture and even micro adhesions in this tissue from being immobilized for so long. She's trying to shear that loose as well.
Yeah. And if anything, she said she rarely sees adhesions break during physical therapy. Like it's not as extreme as that. So I think the main one, if there are more to break through, I'm not sure.
Isn't it amazing? Just a moment of, like you said, really intense pain, which you knew when you consented, you knew it was coming, you had to bite the bullet.
Right.
But that moment of intense pain, a second or two, whatever, it ended months and months of agony, and you weren't even in pain afterwards.
I expected to be in more pain afterwards, but it was an instant relief.
This type of pain, it wasn't like wild guessing or just kind of ripping your arm around randomly. There was a lot of diagnostics and a lot of other treatments, and so it was pretty pinpointedly, diagnostically sure this is what's going on.
Right.
So there's a lot that went into that moment of pain, and we're not telling everyone just someone needs to go through pain. It's okay. This is a little bit different.
So it's a great outcome because the multidisciplinary clinics exist. I think it's a good thing. When all the things and try don't work, then to watch you medical professionals sit there and go back and kind of take that and rise to the occasion of that being a challenge and bring everything to it, or say maybe it's time to move to an orthopedist who can do something that we can't do. But then after that procedure, it's an integrated physical therapy and chiropractic and acupuncture all has its place in the post process as well.
So, then the MRI helps because adhesions are tough. They don't show in X-rays.
That's
right.
You need to be certain of what you're doing.
Right. Good. Excellent. Anything else?
No. Unless you have more questions.
Thanks. Good job.
Thank you.
All right. Thanks.